Hi, I'm Dr. Mukesh Gupta from Lenest, Malad. Today, 1st June, is a day which is celebrated as World Milk Day. Now, why do we do that? It is just to bring attention to an amazing food product which over the centuries to the mankind or also the womankind has been known to be an amazing dietary product. Now, the question here is that can pregnant women have milk? And what type of milk? What about the dairy products? And what about the contents that can be added in the milk? So I'm going to run through in this video about the various aspects about benefits of the milk. One, what are the different types of milk you can have? What are the different processes that the milk can undergo which will help us or which will not be good for us? And last but not the least is what can be added in that? Now when we talk about milk, it has been proven beyond doubt that women who have had larger amount of milk have babies who are healthier, way better, and also in the long life they turn out to be taller. Meaning, if you want your child to be a little taller and healthier, have milk during pregnancy. Another very important concept is that it provides a lot of nutrient value to it. We all know what the value of calcium and protein in the milk and also multiple minerals and vitamins which are available there. Vitamin B12 is also there in some amount besides the amount that otherwise which is lacking in the vegetarian diet. Now, what are the different types of milk that are available? Can we have a whole fat milk or do we need to have skim milk? Well, if you want to cut down on your fat intake, you can choose to have low fat milk. There is no harm. Okay, but if you have whole milk and if your body is not so obese and it's not a big issue about the caloric content, you can definitely have a whole milk. Sometimes the question asked is, can we have soy milk? Doc, I don't like milk. I hate it. Can I have something else? Well, if you have lactose intolerance, then you can think of other alternatives, like for example, soy milk. But the problem with soy milk is if it is had in very large amount, it contains isoflavones, which are estrogenic in nature, which you don't want to take during pregnancy, especially if you don't want any hormonal changes in the babies. So that's the reason. Say maybe less than a cup of a soy milk during pregnancy is during day is not something which can really cause a lot of problem, and there are no human studies to say that there's something going to be wrong, but avoid having large amount of that. Other types of milk like almond milk is very popular amongst a lot of Indian population where they like to have that. Well, it is fair enough, or you can add almonds to the milk. That brings us to another issue, that what all things can be added. The protein powders which are available for supplements during the course of pregnancy contain a lot of material. Sometimes it is DHA fortified, sometimes it is protein fortified, minerals, vitamins, folic acids, etc. Well, even some of them come with probiotics fortified along with the protein powder. You talk to your doctor, or better still your nutritionist, because they'll be in a better position to guide you and help you whether your body is really in need for those extra bit of calories or those particular things as per the diet pattern that you are having. Last but not the least is the commonest question that we face in India is, can we add kesar in the milk? Because as we all have been told over the years that kesar makes your child grow fairer. Well, one of few strands of kesar is not going to harm you, but also large amount of kesar is considered to be uterotonic, and it may cause little contraction and pain, and that is a fear that people have, scientifically not being supported in a big way, but that is what is a common belief. So in simple words, a flavor of saffron, one or two strands which are from good quality and not adulterated, is definitely a good idea. But if you think you're going to have it for having a fairer baby, trust me, it's a myth. It all depends on you and your partner's genes and not on the kesar. Have a good time, have milk, and stay healthy.